Hello, this is Amy BonDurant, and I'll be speaking to you about Case Study 11.2 Early Intervention Services for a Boy at Risk for Nutrition Support. Roberto is a 25-month-old male toddler who was born prematurely at 30 weeks gestation. His parents and caregivers are concerned that he is having feeding difficulties and had an evaluation with the nutritionist at the Early Intervention Center. The main changes noted are that he cries at mealtimes, refuses to eat even his favorite foods, and by observation by the nutritionist and occupational therapist, seems to choke easily when eating. These are all signs that he is having difficulty with swallowing and feeding and should be evaluated further with a swallowing study. As described by Ruback, feeding disorders usually present with food refusal or decrease in intake for age due to behavioral issues or organic conditions. 1 to 5% of infants and toddlers suffer from severe feeding problems that can result in failure to thrive and lose weight. This occurs in 30% of preterm infants. There are several red flags to look for, including dysphagia and aspiration, coughing, choking, and recurrent lung infections. Usually, children with motor dysfunction or structural anomalies begin to refuse food when swallowing food becomes a trigger of pain. The swallowing study can help confirm an abnormality such as aspiration. McSweeney et al. Have found that if a child is cleared to have thickened feeds, it can be a safe alternative to the placement of a G-tube. A trial of thick liquids is recommended first, with the last resort the use of a gastrostomy tube for feeding. G-tubes can still lead to respiratory issues and aspiration of feed contents. It is not clear whether or not the liquids that Roberto was consuming for the swallow test were thin or thick to know if he could have been treated with thickened feeds as a primary intervention. Weight loss is not a reason to proceed with a G-tube unless thickened feeds are not an option for nutrition and need to be avoided. There can be a lot of heterogeneity among children with feeding disorders. A team approach is therefore usually ideal to address all issues that can be present. This will allow for a broad assessment and optimal support. Harada et al. Recommends that occupational therapy is involved to address the deficit in oral motor skills. An RD is needed to address the nutritional concerns, mental health specialists for the behavioral dynamics surrounding feeding, and a gastroenterologist, dentist, pulmonologist, or other physician specialty to address the medical issues and medical management. As outlined well by Crome et al., behavior therapy is needed to help overcome the learned refusal to eat and the fear of swallowing.